Our speaker today is David Cates. He's the author of 5 novels and a book of poetry. He's published dozens of stories and poems in literary magazines. But he didn't always do that. He was born in Madison, Wisconsin, and raised cattle on his family's farm. He worked on construction sites, in offices, in restaurants, on boats. He's driven a taxi. He played professional basketball in Costa Rica. And he was a medical interpreter in rural clinics and hospitals in Honduras. He's taught writing at all levels, from prison classes to public high schools to universities to hospitals. He was the executive director of Missoula Medical Aid for 17 years and has come back into that role in the last month or so. Missoula Medical Aid is an NGO that provides public health and surgical services in Honduras and supplies nutrition and agricultural development projects, supports nutrition and agricultural development projects there. He lives with his wife, Rosalie, in Missoula. They have 3 daughters who are apparently currently at home. So, David, we're glad you could join us and take it away. I've already allowed you to share the screen, and I'll ask everyone else to put themselves on mute so we don't get too much distortion.
Okay, thank you. I'm actually not going to share the screen. I'm not going to give the little slide show presentation of Missoula Medical Aid for a couple reasons I'll get to. But as Jim said, I was the director of Missoula Medical Aid from the beginning. Our first trip down was 1999, I think, and until 2017, and then I stepped down and a new director came in, and she was great, but she has 3 school-age kids, and it was hard to be doing this job and raising your kids and selling real estate. And so she stepped down from the job in May, and I became the executive director in June. My first act as the executive director was to ride my bicycle with my brother from Sandpoint, Idaho to Glendive. It was a trip I already had planned. So that was an adventure that I did mostly in June. So I'm back as the director, but very recently now, just the past few weeks have I really been working. And or since the beginning of July anyway. And what I find myself in is a situation where this organization that was for a long time sending 3 teams a year of volunteers to work in rural clinics in Honduras and rural hospitals doing specialty work, primarily orthopedics. Well, we can't travel, and we hadn't sent a team in 6 months, and we have no plans to send a team in the next year. Honduras is closed down. It's not safe to travel in this time. And so now what do we do? And what the real driving need is for food support, because people are not getting enough to eat. So in some ways our mission has become very simple. For the next 6 to 8 months, we are simply going to be raising money to try to avert acute malnutrition in some of the areas where we're working, because people cannot leave their house to work. In Honduras, the shutdown is almost complete. You can only leave your house once every 10 days. It has to do with the last number on your national ID card, which is, if it's whatever that digit is the day you can leave the house and do shopping. There's So the populations we work with are hungry. People aren't working, and they can't pay rent, and they can't buy enough food. They're eating one meal a day. Um, we've heard this from many of the people we have worked with down there. So our mission is really changed to raising money and finding ways of getting the money to our partners, people we've worked with for a long time down there, in and figuring out the best way to distribute food. Um, all we've done so far is we diverted money we were going to spend this spring, about $15,000, and that money's been diverted to handing out food packets, baskets of food, essentially to families in these rural areas. And these are baskets that are meant to last a week for a family of four. Well, most families are bigger than four, so it's a little drop in the bucket. And we also one of our programs have been over the years is work with farmers, small farmers, and groups of small farmers as they diversify their crops, and also start growing various, besides just beans and corn, start growing cold weather vegetables that they can sell in the city. A lot of these crops are not able to get to the city now because commerce has shut down. So how do we distribute the foods on these little farms to families around who need cold weather vegetables like broccoli, cauliflower, carrots, also potatoes is a big crop there too, and that's one that that people eat regularly. And so we are kind of in the midst of a growing crisis, and it's really dynamic. So the facts on the ground are changing quickly. We have an operations director in Honduras, a young woman who's worked with us for about 6 years, and we're very dependent on what she can learn in order to spend the money we are soliciting in the best way possible. And I've been communicating with her every day, and she's communicating with our partners and trying to figure out how. Right now, we have $6,000 that we've raised recently. Where do we send it? What's it going to do? And we're trying to answer those questions. We'd like to raise $80,000 by the end of the year, and but raising money and spending money are two different things, and we're trying to figure out both at once, particularly the spending. And because the ground is shifting down there so quickly, we're not sure the best way to do things, and so we're going to be working one step at a time, one small step at a time, trying to get food to people who need it. And because by fall the malnutrition will move will move into acute stages, and we just want to do as much as we can um, to lessen the impact of that. There's going to be a lot of people suffering as a result of this virus and the economic shutdown, and we're trying to do a little bit from what we can raise here in Missoula, and uh, funnel to our trusted partners. We have wonderful working relationships with Honduran groups, people in Save the Children Honduras, people in local Lions clubs where we have supported dental and eye clinics, and we have other people who we may be able to partner with as this thing moves on. But as you know, just sending money to another country without having trusted partners is not smart. And luckily, we have a couple of trusted partners, and we're looking for more. So that's what we're doing, and it's it's a real vital mission right now, and very very narrow. I get texts from people in Honduras. on my phone just yesterday, this woman who I know who's worked with us as an interpreter, she lived in North Carolina for a while, but she pays $80 a month rent. She's a single mom. She's got 2 kids. She hasn't been able to pay rent. Her kids are eating once a day, and so that her story, and she was what you might have considered a lower middle class Honduran. She was not poor, and now she's right on the edge. So that's what we're doing. It's not a happy story, but it is one of the things I feel about the opportunity is it's vital, it's real, it's if we do as well as we can, we actually are bringing helping kids eat food. I mean, is there anything more important? You mentioned my 3 adult daughters and son-in-law and another partner of another daughter, and everybody's here, and the grandkids, and I always love making dinner. It's like the most basic thing on earth, the most joyful thing you can do, right? Is give food to your offspring. So that's the joyful part of it, is if we can raise money, send food, send money to buy food down there, and help small farmers make adjustments in what they're planting. We have always had a seed program and technical help in growing food, and and I mean, seeds, we just go down to Ace Hardware and buy seeds, but man, the value of seeds when you don't have any money is a tremendous thing. And so to be able to distribute seeds and get people gardening will not give them food tomorrow, but we'll give them food in a few months. So that's the work we're doing, and yeah, and I don't know if I have any more questions, any more to tell you, because as I say, the situation's really dynamic on the ground, and kind of dynamic up here too, as we kind of scramble to put together a fundraising plan, which is so dependent really on the actions that we are doing down there, which right now are just beginning. We're just trying to figure out what we're going to do. We know what we did last month, but we don't know what we're going to be doing in a month. So it's kind of trying to keep balls in the air and trying to stay ready for whatever opportunities present themselves in Honduras for us to be helpful. We live in a country where it's not doing so great itself, and I've been asked, well, why should I give money to help in Honduras? I mean, and I say, no reason. I mean, I give money to the food bank, I give money to the Poverello Center, give money here. People need it here. But our organization happens to work in Honduras, and so that's what we have a 20-year connection now to the communities where we've worked. We've sent 60 teams of people down there. We've made a lot of friends and a lot of trusted partnerships, and a lot of have some deep connections in those communities. So that's what we're doing, and that's what we will do during the course of this year. And let's hope that, and all with the hope that this is going to pass, the knowledge that it will pass. And but for the time being, we drop kind of what we have been doing and what we thought we were, and we try to become what is necessary now. And so I don't really have much else to say besides that. I hope if you all have any questions, I'd love to answer. Maybe even I might have a story or two.
Or questions or ideas,
Yeah.
Gary?
Yeah.
Unmute yourself.
Good morning, David. Gary Hughes.
Hi, Gary.
I don't have a question, I just have a comment that I know the good work that you've done over the years. Doug and Nellie McClelland, Dr. Zahn, I remember the stories they came back from Honduras and told. I mean, we as Americans have no clue what those folks are going to, and those folks that question what your work is, that's a sadness. So just thank you for the work you do for humanitarian efforts. And, I know it's tough. God bless you, and I hope you just keep rolling. So thank you.
Oh, you're welcome. I don't feel like I really do that much. There's a lot of volunteers, a lot of people who are really supportive, and my job's kind of to only kind of try to organize the effort, but there's a lot of people who put a lot out and donate money and, and time, but thank you.
Can you tell us where to make a donation to? Where to mail a check?
Yes. You can, if you want to, it depends on if you want to mail a check or you want to mail a check.
I do.
Okay, it's box 903.
Box 903.
Missoula, Montana.
Okay. 59.
Just a second here. Five 59806.
And what's the name of your organization?
Missoula Medical Aid.
Missoula Medical Aid.
Yeah.
All right.
Yeah.
I think what I took from it is how important it is to have had a long-term connection so that you know exactly what your money is accomplishing. That must be really satisfying to you and to your donors. That must be nice.
It is it's vital. It's very important. I used to say when I did this job, if somebody gave me $10 million, I wouldn't know what to do with it. $10 million is a lot of money to spend. You have to have established partnerships so you know how to spend that money. It's hard to spend $10 million, but our organization's always been smaller and we've had appropriate partnerships. But so yeah, that is the key.
Well, David, you could always get yourself a congressman. They know how to spend that kind of money real easy.
They do. Yes.
Nay,
I'm interested how you got started in Honduras, how you picked that area and what that process was at the very beginning.
Well, there was a massive hurricane that hit the Central American Isthmus and just kind of settled over Honduras and Guatemala and Nicaragua in 1998, the fall of 1998, called Hurricane Mitch. And it just settled and poured rain for a week straight. And Honduras is a very, very mountainous country and so you have a lot of drainages with communities that by the side of the river, and these places were washed away. And it was a huge natural disaster that caused hundreds of thousands of homeless and tens of thousands of deaths. And there was I don't know if you know Nightingale Nursing or Montana Home Health. I don't know if any of you know Bill Woody. He has but now is a giant business that provides home health care. But at the time, it was a very small business located in a house on the corner of South and Higgins. He had about 10 employees, and they did home health care. And apparently, a few of them didn't have any place to go that morning, and they're reading the newspaper about Hurricane Mitch, and they kind of jokingly say, "Yeah, we should go down there. They need us down there." And Bill is the kind of a guy who says yes to everything and then figures out how to do it. And so he says, "Oh, okay, let's try to do that." And he calls the newspaper and says that they need people to go to Honduras. And I see in the newspaper the next day, and I was had finished a draft of a novel and needed to put my brain in a different place. And I speak Spanish. And so I said, maybe I can help. And so I walked a few blocks from my house down there, and they said, yeah, we're going to send a team. We sent a team on Thanksgiving Day of '98. We sent a team New Year's Day. We sent a team in February, sent a team in March to do immediate hurricane emergency relief, both medical and building. And we worked tightly with Save the Children Honduras, and we, after that, we thought, well, maybe that's it. Maybe there's no place for us in the long term. But we sent a team about 6 months later to talk to potential partners, and we were asked to try to send teams regularly, medical teams regularly, to provide access to medical care in places where that was non-existent. So we started to do that and I was real involved in all those early trips. And then, but it was always kind of like, let's try to raise some money and go next year. But after a few years of that, it became clear to me that when our partners down there asked me when we were going to come again, and I wouldn't be able to give them an answer, that we needed to step up a little bit. So I said to the board, I said, I'll continue to do this, but it has to be a paid position, very small pay, but it has to be a paid position. And then I can make it, make commitments and meet commitments rather than just go, well, we'll see what happens. And so it became more regular about 2002, where we decided, okay, we will make commitments and we'll meet the commitments. And that, of course, that's how partnerships are built. I remember there's a hospital in La Esperanza, a place where we worked a lot in that area. We didn't work in the hospital, but we ran into the hospital director one night at a restaurant, and he said, we don't have any orthopedic stuff here. I mean, and we certainly noticed it in our patients. Little kids would fall out of trees and they break an arm, and they have a crooked arm their whole life. So he said, I don't know if you can send an orthopedic team down. And we said, oh, well, I think we can. And I came home and I visited the hospital. Then I came home and I talked, I don't know if you know Gary Wilstein. He was a friend. And I said, Gary, you want to go down and work in La Esperanza? And he says, well, that might be interesting. I said, well, I want to warn you. I said, they don't know us. And I told them, and if I tell them I bring an orthopedic person down, they will say, well, okay. But when you get to the hospital, it will not be prepared for you. It will be chaos. And you may spend the whole week and do one surgery. But the second time I say I'm going to bring an orthopedic person down there, they will be better organized. But we need a pioneer. And Gary said, okay. And so he went down, and it was chaos, and he didn't have a place to even see patients. And eventually there was somebody he could help, but it was a whole week of kind of that, which can be frustrating for doctors. They go, I'm here to help somebody. There's no system here. Doctors don't operate without a system, somebody to take x-rays. And so sure enough, the next time we sent somebody down, they were better organized and better. And we've sent many teams down, and the meshing of between the hospital and our teams is just beautiful. But that's kind of how it started. In little projects, noticing a lot of the patients with rashes on their skin from application of farm chemicals, and then getting involved in farm programs that taught safer ways to use chemicals, and the use of safer chemicals, and the use of no chemicals and when possible, and then the diversification of crops and then moving into helping small farmers. In La Esperanza, it's a very good cold weather vegetable area, but how do you get the crops from there to Tegucigalpa? and get a decent price. And we were helpful in the creation of a co-op and a warehouse and a truck that left twice a week to go into Tegucigalpa with to supply Walmart Tegucigalpa with vegetables. So those little things just all built gradually.